So anyway, the first time the nurse anesthetist had, apparently, I didn't know this, had given me more than the normal amount of knock 'em out kind of drugs, and it wasn't a general anesthesia, but it was kind of a twilight thing where they give you, I don't know if it was Versed or what it was, but they kind of just put me in a,
It was probably Versed.
something like that. It was a cocktail. I think it was more than one thing. So the next time I go in and the nurse anesthetist is talking to me before the procedure, and this time it's somebody different, and she said, so were you really inordinately nervous the last time? Did you have a lot of anxiety? Because I noticed he really gave you a lot of drugs. And I said, no, I wasn't. I think I was fine. And she said, okay, well, I'm not going to give you as much this time. So the difference was, the first time I really don't remember much from the procedure. The second time I remember everything, because I was awake the whole time. And the doctor was actually, the surgeon was narrating everything he was doing, because there was a student on the other side of the room watching the procedure on a computer screen. So somewhere near, I don't know if he was wearing a camera or, because I don't know if you know this, but you can hear you can hear what's going on in an eye procedure. You really can't see what's going on in an eye procedure. You see a little bit at the beginning before they start messing with the lens.
Right.
But then you really can't see. It's all just blurry and sometimes even completely dark.
Right.
So.
And didn't they have to take, when they take your cataract off, I mean, doesn't that also affect what you can see while it's off until they put the lens on?
Yeah, but it's not like, it got dark, but I think it's just because the lens, not having a lens doesn't make you go dark.
Okay.
It doesn't make you go blind. But it did something weird. I watched it. Like, I knew what step he was on, and I watched the lens leave.
Ew.
It was weird. It was weird. But I was fascinated. So I wanted to see, like, what's going on. So, because years ago, they used to do cataract surgery. Before they had the ability to give you new lenses, they would still remove the cataract. That's why people walked around with those big Mr. Magoo glasses. So they could try to see something. Because they removed the cataract, but they didn't have the ability to actually give you a new lens. The doctor told me that. I'm not making that up. So you're not completely blind without your lenses, but everything's just blurry. You wouldn't be able to. Anyway, so the second time I listened, and he did a couple of proactive things to keep the overfiltering from happening again. And what he did was he did an extra dissolvable stitch near the tube, and he did an extra little burst of viscoelastic gel right at the end of where the tube comes out inside my eye.
And you didn't have that.
And it did not overfilter the second time, and the recovery was so much different because of that. Recovery was fine. This happened right before Christmas, and we hosted our Christmas party as usual. I was tired, I was in a lot of pain, but I could do it.
And you guys traveled to see a new grandchild. Just not many days.
2 days. So I forgot. So we had a grandchild that was due in January, and the cute little princess decided to come 26 days early, which was 2 days after my surgery. And we had to drive to a city 4 hours away to get there to see the baby, and we were there for a few days.
Probably wouldn't.
A couple of days.
Have been
We
able
stayed
to
for
do
two
that.
nights. We stayed for 2 nights. I would not have been able to
Not
do
with
that
the
the first
guy.
time.
No.
I wouldn't have been able to. I wouldn't have been able to leave town.
No.
Because the pressure had dropped, and I had to go
Right.
back, and he had to do all the things. I wouldn't have been able to go.
Right.
So the second time, I'm sitting in a labor ward, and we're holding our new granddaughter, grandchild number 7, who came 26 days early, but she was fine. Everything was fine. Mommy was fine. Daddy was fine. Baby was fine. Everything was fine. So, but I was only 2 days post-op sitting in that room.
Right.
And a long car ride back, and
at this point,
not sleeping in my own bed for 2 nights, and
you're this far out from both surgeries now, and so the only thing that you're still noticing is some swelling and dark circles at this point.
At this point, the eye still feels very tired, and I think it shows that it feels tired. I think I look tired, even when I'm not tired. I think I look tired, and I have swelling up here that's still there. It's still very swollen, like right here, which I can't explain because the valve is over here. But there's a lot of swelling here. There's 4 quadrants that they can choose from to implant the valve, and it's up on the upper outer one on this eye, and same upper outer on this eye. And maybe one of these days you can get like in there with the camera and and we'll take a picture so they can see it.
See what it looks like.
See what it looks like. And the Ahmed valve itself looks like a little horseshoe crab. And they actually make a slit in the sclera. They make a little pocket like a kangaroo pouch. They drop that valve in there. They stitch some donor sclera over it. And then they make a hole into the eye, right into the vitreous humor, and they take the little tube that attaches to the valve, and they push it through that hole right into the eye.
Okay.
And then all of that. The video is really, I don't know if you've seen the video.
I think I did watch it before your surgery.
There's an animated video on YouTube. If you just look up Ahmed Valve Surgery, it's an animation, so it's nothing creepy. But some people are just creeped out by anything with the eye. So, but you know, I started wearing makeup in junior high, and I started wearing contacts when I was 16. So you know, it doesn't.
You're touching your eyes a lot.
Yeah, I'm touching my eyes a lot, and that doesn't freak me out. The eye stuff with the eyes doesn't. The eye at the beginning, knowing that they were doing 2 surgeries on my eye, was kind of messing with my head. But I was fine the second time. Really, I was fine.
Right, because you knew what to expect.
Exactly.
And you trusted your doctor.
Right, and I think it was the unknowns. I didn't know what it was going to be like. Okay, so how are they going to keep my eye open? And what was that was I going to be aware of? Was I really going to feel that my eye is being held open? And what was that going to feel like? Just so you know, you can't feel it. You don't feel, you know that your eye is open, but you can't feel it. They give you so much local anesthetic that you don't feel it at all. And they keep the eye hydrated through surgery, and you don't feel that you can't feel it. You can't feel the thing that's holding it open. You don't feel any of that. You don't.
Which is good.
Yeah, I think that's what was kind of freaking me out more than anything is what's that going to be like? It was so unknown.
And I think this is helpful for somebody that may have this surgery coming up.
Right.
To get some idea of what to expect.
Right, and any surgery can have complications, and there's always things that can go wrong, and I can't promise that nothing will go wrong.
But for you so far, it's been worth it.
It has been worth it. It has been, and being able to have a better idea that my pressure won't spike to a dangerous place is worth it.
And you were saying before that the expected length of time.
So I researched a little bit, and I did find a .gov article about the Ahmed valve, and I probably shouldn't have, but I did. And they are finding so far at 5 years, only 49% of the valves are still functioning. So I don't know if that will happen with mine. Time will tell. But for me, if I can, if we get the steroid implants in this year, and I get 5 years of slowing the progression of the damage to my eyes, it's worth it. It's all worth it.